And did you know your teeth can reveal secrets about your overall health? Your mouth is a window into your body. What happens there often reflects deeper health issues. Dental health and general health are deeply connected. Today, we'll explore 7 signs your teeth and gums might be showing you, what they could mean, and what you can do. Think of your dentist as a key member of your healthcare team. Some of these connections, like how tooth loss links to bone health, may surprise you. Let's get started. Let's start with a big one: gum disease and heart health. You might not immediately connect your gums to your heart, but the relationship between oral health and cardiovascular health is stronger than most people realize. Periodontitis, a severe gum disease, starts as gingivitis, red, swollen, bleeding gums. These early signs are your body's way of warning you that something isn't right. If left untreated, gingivitis can progress to periodontitis, which damages the tissue and bones supporting your teeth. Over time, this can lead to tooth loss and even changes in your jawbone structure. But the effects don't stop in your mouth. The inflammation and bacteria from gum disease can enter your bloodstream, traveling throughout your body. Once in your bloodstream, these bacteria and inflammatory signals can trigger inflammation in your arteries, contributing to atherosclerosis, hardening and narrowing of the arteries, which is a major risk factor for heart disease. This process increases your risk for heart attacks and strokes. In fact, people with gum disease are more likely to experience cardiovascular events than those with healthy gums. That's why dentists checking for gum disease are also, in a way, screening for your heart risk. Your dental visits are about more than just your teeth. They're a window into your overall health. Scientists have even found bacteria from the mouth inside heart artery plaques, showing just how far-reaching oral bacteria can be. Chronic gum inflammation keeps your body in a state of low-grade inflammation, which is tough on your heart. This ongoing stress can make it harder for your cardiovascular system to function properly. Having periodontitis increases your cardiovascular risk, even if you don't have other risk factors like high blood pressure or high cholesterol. Gum disease is an independent risk factor for heart problems. Both the American Heart Association and American Dental Association recognize this important link. They recommend paying close attention to your oral health as part of your overall wellness plan. Brushing, flossing, and regular dental visits help control bacteria and inflammation. These simple steps are powerful tools for protecting both your mouth and your heart. These habits are easy to incorporate into your daily routine and are proven ways to lower your risk for heart disease. Taking care of your teeth is truly an investment in your long-term health. Don't ignore bleeding or swollen gums. Get them checked as soon as possible. Early intervention can prevent bigger problems down the road. Your heart might thank you for taking these small but important steps. Remember, your body is interconnected. What happens in your mouth can affect your entire system, including your heart and blood vessels. Oral health is preventative medicine for your heart. By caring for your gums, you're also caring for your cardiovascular system. Next time you think about skipping flossing, remember it's not just about your teeth, it's about your heart too. Small daily habits can have a big impact. Consistency is key, and every bit of effort counts toward a healthier future. Pay attention to your gums. They're telling you more than you think. Take action early and you'll be supporting your heart for years to come. Let's talk about tooth enamel, the hardest substance in your body, but surprisingly vulnerable to acid. Enamel acts as a protective shield for your teeth, but it can't repair itself once it's worn away. That's why noticing changes in your enamel is so important, not just for your smile, but for your overall health. Erosion on the chewing surfaces and backs of teeth can signal acid reflux or GERD, a digestive disorder where stomach acid flows back into the esophagus and sometimes even reaches your mouth. This isn't just a dental issue, it's a sign your gut might be struggling. GERD allows stomach acid to reach your mouth, especially at night when you're lying down. You might not even realize it's happening, but your teeth can show the evidence long before you feel heartburn. This acid is strong enough to dissolve enamel, leading to yellowed, sensitive, and worn teeth. Over time, you may notice increased tooth sensitivity to hot or cold foods, or even pain when brushing. Dentists often spot GERD before you notice symptoms yourself. They're trained to recognize subtle changes in your teeth that most people would overlook. The erosion pattern is a giveaway, especially on the inside of your upper teeth and the chewing surfaces of your lower molars. These areas are most exposed to acid during reflux episodes. If your dentist sees this, they may ask about heartburn, a sour taste in your mouth, or a chronic cough? These questions help connect oral symptoms to possible digestive issues. Early detection is crucial. Untreated GERD can damage your esophagus and even increase your risk for more serious health problems like esophageal cancer. If GERD is suspected, you'll be referred to a doctor for treatment. Managing reflux early can prevent long-term damage to both your teeth and your digestive tract. Managing reflux protects both your teeth and your digestive health. Simple lifestyle changes like eating smaller meals, avoiding late-night snacks, and elevating your head while sleeping can make a big difference. Dentists may recommend fluoride rinses or desensitizing toothpaste to protect enamel and reduce sensitivity. These products help strengthen your teeth against future acid attacks. Severe cases might need crowns or veneers to restore function and appearance, especially if enamel loss is extensive. Treat the root cause and protect your teeth. Medications, dietary changes, and dental treatments all work together to keep your mouth and gut healthy. Your mouth can reveal what's happening in your gut, so pay attention to the signs and let your dentist be your first line of defense for both oral and digestive health. Persistent bad breath isn't just embarrassing. It can actually be a warning sign of something much more serious, like uncontrolled diabetes. Many people don't realize that what's happening in your mouth can reflect what's going on in the rest of your body. If you notice your breath smells off, it's worth paying attention. Diabetes affects how your body uses insulin, which is the hormone that helps control blood sugar. When insulin isn't working properly, blood sugar levels rise and can get dangerously high, impacting your health in many ways. When your cells can't use glucose for energy, your body starts breaking down fat instead. This process produces chemicals called ketones, which can build up in your blood and spill over into your breath. Ketones cause a distinctive fruity or nail polish remover-like odor on your breath. This isn't just a minor inconvenience, it's an urgent warning sign that your body is in distress and needs immediate attention. This can indicate diabetic ketoacidosis, a life-threatening condition that requires emergency treatment. Ignoring these symptoms can put your life at risk. Even before things get that serious, high blood sugar feeds bacteria in your mouth, making gum disease and bad breath much more likely. You might notice bleeding gums, swelling, or persistent mouth odor. Diabetes also weakens your immune system, so gum infections become harder to fight off and can linger or worsen over time. Gum disease and high blood sugar create a vicious cycle. Each one makes the other worse, making it even harder to control your diabetes and oral health. Dentists are often the first to spot these warning signs, sometimes even before you notice any other symptoms of diabetes yourself. If you have persistent bad breath, gum problems, or other unusual changes in your mouth, don't ignore them. Get your blood sugar checked as soon as possible. Early diagnosis of diabetes can prevent serious complications and help you take control of your health before things get worse. Good oral health is critical for managing diabetes. Brushing, flossing, and regular dental visits are essential parts of your care routine. Your dentist could be the first to catch a hidden health issue, so don't skip those checkups. Don't ignore the signs. Your breath could be the clue that saves your life. Listen to what your mouth is telling you and take action for your health. Waking up with a sore jaw or sensitive teeth. You might be grinding your teeth, bruxism often caused by stress. Grinding puts intense pressure on teeth, leading to cracks, pain, and sensitivity. Cracked tooth syndrome can be tricky to diagnose. Pain comes and goes, and cracks may be invisible. Untreated cracks can lead to infection or tooth loss. Chronic grinding also wears down teeth and damages dental work. It can cause jaw pain and TMJ problems. Dentists spot wear patterns and may ask about your stress levels. The most common solution is a custom night guard to protect teeth. But managing stress is key. Consider meditation, exercise, or counseling. Reducing caffeine and alcohol can help. A healthy mind supports a healthy mouth. Your dentist can help you connect the dots. Don't ignore the signs. Stress shows up in your smile. Healthy gums are pink, but pale or whitish gums can signal iron deficiency anemia. Anemia means your blood lacks enough healthy red cells to carry oxygen. Low hemoglobin makes gums look pale, sometimes before you feel tired or weak. Dentists often notice this subtle change during exams. Pale gums, tongue, or cheeks are key clues. Anemia can also cause a sore, smooth tongue and cracks at the mouth corners. If your dentist suspects anemia, they'll recommend a blood test. Treatment usually involves iron supplements and dietary changes. Restoring iron levels brings color back to your gums. Oral signs can lead to early diagnosis and better health. Don't overlook pale gums. They're a window into your blood health. Your mouth can reveal what your body needs. Occasional mouth sores are common, but frequent or slow-healing sores can signal immune or nutritional problems. Recurrent canker sores may point to autoimmune diseases like Crohn's, ulcerative colitis, or lupus. Lupus can cause painless sores on the roof of the mouth, an important clue for diagnosis. Immune deficiencies like HIV can lead to mouth infections and ulcers. Nutritional deficiencies, B vitamins, zinc, iron, also increase mouth sores. Dentists look for patterns, frequent sores, other symptoms, or unusual locations. They may recommend dietary changes or refer you to a doctor for further testing. Your mouth is a diagnostic canvas for your immune system. Don't dismiss persistent mouth sores. They could be early warning signs of bigger issues. Talk to your dentist or doctor if you notice them. Early attention can make a big difference. Your mouth reflects your body's defenses. Tooth loss isn't just a dental problem. It can signal osteoporosis, a disease that weakens bones. Osteoporosis makes bones fragile, including your jawbone, which anchors your teeth. As jawbone density decreases, teeth become loose and may fall out. Women with osteoporosis are at higher risk for tooth loss. Dentists can spot low jawbone density on X-rays and may recommend a bone density scan. This is crucial for planning dental treatments like implants, which need strong bone support. If you're losing teeth without clear dental reasons, ask about your bone health. Protecting your bones, calcium, vitamin D, exercise also protects your teeth. Your dentist might be the first to spot osteoporosis risk. Oral health and bone health are deeply linked. Don't compartmentalize your health. Everything is connected. Take steps now to protect your bones and your smile. Your teeth reflect your skeleton's strength. Your mouth is more than a tool for eating. It's a diagnostic window into your health. From pale gums to cracked teeth, the clues are right in the mirror. Paying attention to these signs helps you take charge of your health. Regular dental checkups are powerful preventative screenings. By caring for your mouth, you invest in your whole body health. If you found this helpful, subscribe and share your stories in the comments. Stay healthy, stay curious, and see you next time.